That time to answer some of your more common health questions. Joining me is News Channel 5's medical expert, Dr. David Soria, the Chief of Emergency Medicine at Wellington Regional Medical Center. Great to have you. I don't know that I have heard of this before, but a lot of our viewers may have. Such a thing as the longevity gene?
You know, we don't really know, but that's what they're looking into. And, you know, we've always wondered, is it clean living? Is there a gene that's causing people to live longer than most? Or is it just good luck? So scientists at Stanford actually set out to look at this. And they reviewed the genome. They sequenced the genome on 17 people that were aged 110 to 116.
Okay.
You know what they found?
What'd they find?
Nada. They didn't find a thing. There was absolutely no common genetic trait amongst any of these people. So the reality is that we don't know. There's a lot of research that needs to be still had and still kind of look into this. But one thing's for sure, of the people that they looked at, there was no commonality. So matter of fact, there wasn't even any common health or like clean, healthy living characteristics. They didn't eat well, they didn't exercise, and half of them smoked.
All right, so we'll just keep a big question mark on that
Exactly.
one. Let's talk about heart disease and perhaps the best way to prevent it.
Yeah, well, the best way to prevent it is to be aware of the 5 major risk factors. Number 1 is family history. Nothing to do. You can't pick your parents, but it certainly allows you to be a little bit more vigilant, know that you're at risk, and make sure you see your doctor to review your risks upon knowing that there's risk there.
Okay.
Diabetes, that's another one. Monitor your blood sugars closely, make sure you follow up with your doctor and police that very closely. Smoking, clearly stop, right? That puts you at risk.
That's a good one.
Make sure you don't do that. Hypertension is another. If you take your medications and your blood pressure is within normal on your medications, you're no more at risk than someone without blood pressure. So that's key. And cholesterol is the last one. If you're having high cholesterol, make sure you take your meds, eat right, exercise, follow up with your doctor, get that checked regularly, and again, your risk then tends to diminish.
All those things we don't necessarily do, but no, we should.
You don't.
Yeah. All right, so if you have a question for the doctor, you can send it in directly by going to our website, WPTV.com, click on the health link, scroll down on the right-hand side. You're going to see a form there. Write your question, and we can't wait to ask the doctor. Thanks so much for coming in. We'll see you next week. We'll see you after this.